Welcome and good afternoon to number 6 Convent Place for our daily press conference and information briefing on COVID-19. Today I'm going to address our updated statistics, tell you about Cabinet's approval this morning of our Unlock the Rock document, and then move on to some new and exciting news about what the future may hold in that respect. Let me start first with the statistics in respect of the progress of the infection through our community. The number of tests carried out now is 2,931. We have 60 results pending. We have received 2,871 results, and the number of confirmed cases remains static at 144. The number of recovered cases is increased by 1 to 133, and the number of active cases is down to 11. As at May the 4th, the number of deaths brought about in Gibraltar by the phantom menace, that is the COVID-19 virus, remains 0. And there are no patients confirmed with COVID-19 in any of our COVID wards or ERS. This represents a new hope that we are winning the battle against COVID-19 unless the virus strikes back. It is against that background that the Cabinet this morning has approved the Unlock the Rock document. This will be our route map out of lockdown. I expect we'll be in a position to publish this document in the next 48 hours. The document is comprehensive. It is taking time to finalize this in order to be as full and as useful as possible once the document is published. And it is a document being compiled against the backdrop of an ever-changing scientific understanding of the COVID-19 virus. I've shared it with the Leader of the Opposition, and he has shared it with his team also. I've consulted widely on it and will continue to do so. Remember, this has to be a dynamic document, as we may need to change what we are going to do as the science continues to change. Our unlocking plan will set out the 6 phases we presently expect to transit before we get back to rock unlocked phase normal. We're now already half a week into phase 1. In this respect, we've seen retail shops, construction, and hairdressers and beauticians able to reopen, but subject to some restrictions. Our whole strategy to unlock rests on 2 key criteria. The first is that the advice on social distancing and respiratory and personal hygiene must be followed. And the second is massive testing, aggressive contact tracing, and enforced self-isolation in order to ensure that any future cluster of the disease does not become a surge. In that respect, let me elaborate a little further. We must understand that we cannot go back to what we used to call normal, however much that may be our natural instinct, in particular when the sun shines. A virus, like any other predator, is looking for us to relax our guard. When we do, it will pounce. That will be when we see a new attack of the virus. So in order to keep the virus at bay, to stop the return of the virus, we must be able to come out of our homes once again, but to do so observing the rules of social distancing. Otherwise, we will see a second wave, which would really enable the revenge of the virus to be manifest on us. That phrase, the rules of social distancing, is becoming quite ubiquitous these days. We need to understand what it means and how difficult it is to write down in law and to police. What it means is that we need to avoid touching each other, shaking hands, hugging, etc., outside of our household bubble. Additionally, it means that we have to stay between 1 meter and 2 meters apart when we're not with our household grouping. It also means that we have to avoid large crowds, as it may be harder to keep those distances if crowds accumulate in tight areas. But let us be clear. Asking law enforcement to police such rules is dystopian. It would put huge pressure on police, and it has severe repercussions in civil liberties terms. So we must avoid that. That is why, to a great extent in future, we will be policing ourselves, and we have to have new norms of social behavior, new values which we apply to ourselves and expect of each other. I think most, if not all, already understand this, and there have been very few instances of concern in this respect. Additionally, it is important that we should understand what we mean by enforced self-isolation. This is likely to be coercive. That means that we are looking at fines and, if necessary, enforced confinements, which would ultimately mean imprisonment, for people who refuse to self-isolate once they have been diagnosed. Because a person who has been diagnosed will become a focus of contagion if they do not self-isolate. We have concerns that this may be starting to become an issue, and we will therefore be consulting on amendments to our regulations going forward, requiring such people to self-isolate by compulsion of law. This may seem draconian, but it would be the only tool available to us if people are irresponsible enough to come into contact with others when they know that they are infectious. Our detailed document will address more aspects of this. But I must say that I think this weekend has gone well. Our law enforcement agencies have done a magnificent job. We just need to be mindful that although our retail shops are now open for limited hours, we are still only allowed out to access a shop alone. We're not able to go out as a family to the shops. If you need to go to the shops, go as if you were going to one of the supermarkets. Normality has not yet returned. Please do not fall into the trap of thinking otherwise. The sun may be out, but the virus is out there also. The virus will strike back if we become complacent. So the beaches will remain closed for now. You will only be able to enter if you are over 70 during the golden hour period. If you're under 70, you will be allowed to access the beaches for exercise, which can include a swim. You'll be allowed limited time on the beach, about 30 minutes. Enough for a walk and a quick dip, or for a run for the more adventurous. But that is it. If you have a relative who you are accompanying as a carer, and that relative is disabled or suffers from autism or any other similar condition, you will be allowed longer. You can identify yourself with your disability information card. Our Unlock the Rock document will address these matters also. This week, we're also working on two new aspects of the Beat COVID measures. The first will involve allowing businesses in the excluded sectors to make employees inactive and pay beat of 50% of the salary of the employee, or the Beat COVID rate of £1,155, whichever is the higher. The maximum part of the workforce to which this will apply will be 25%, unless discretion provided for in the law permits the application to a greater number. Any employees affected will only be able to be subject to this for 4 out of the next 8 weeks until the end of June. There will be a filter via the Financial Secretary and the Director of Employment to be able to qualify for this non-beat furlough. There will also be an opportunity for representations from an individual's trade union or the individual himself. I've consulted CELAC and the opposition on this and have broadly agreed how this would potentially operate. The details are being drafted now. Additionally, we're working on a variation of the Beat COVID measures for the included sector also, to allow employees to be brought back in part. This will therefore allow an employee who was made inactive in April to be brought back for, say, half the month of May. That employee would still qualify for half the beat payment they received in April and could be made active for half the month. This is also in its drafting stages. We shall publish the updated rules as soon as we are able. I can tell you that we continue to receive many queries on beat payments refused and the amount of beat payments approved in some instances. We're working through all of these. The volume is high, so please do bear with the teams which are working tirelessly on these responses. They really do not stop, and I acknowledge the magnificent work that they are doing on this. Also, we've now agreed how to progress matters in respect of new rules on insolvency, which are being prepared for this period. I expect we will be publishing a bill in respect of these matters this week. The law will cover the whole of the pandemic period and will therefore likely have an element of retrospection. I expect we will be able to deal with it in a parliamentary session in the last week of May. We've seen today the start of how life will be in the future. At our entry points, we're already deploying quite rudimentary temperature scanning. Not fail-safe, but a useful aid to those who may not know that they're running a temperature. We're already seeing face masks deployed in our businesses, inside shops, hairdressers and offices where social distancing cannot be observed. We're likely to see that also in the return of public transport and elsewhere in the future. A less brave new world than before, perhaps, but the world into which we are condemned to live for now. Is it that bad? In my view, if we get back the ability to return to you your constitutional freedoms sooner rather than later, then it is a proportional requirement in keeping with our medical advice that we must see through. I've often told you in the past weeks that the first duty of government is to protect life, to protect your safety and your security. Undoubtedly, it is our immediate next duty also to protect your civil liberties. And in developing apps to help us with contact tracing, we will have that at the top of our considerations. This weekend, I was on a call with Apple developers for the iOS system to enable that decentralized system of track and tracing. This is likely to give us interoperability with the Spanish systems, which appear to be pointing also to this decentralized mechanism. We nonetheless continue in contact also with NHSX, also in the potential use of their centralized systems. And the changes in our world and the way in which we work will not all be bad. We have to be brave in the way that we shape the future. We will be. That is why today I can tell you that our plan to unlock the rock will also contain provisions to close a number of traffic arteries in order to seek to reduce pollution. In a key pilot project, we will close Linewall Road as from the 1st of June. The closure will be from the area of Orange Bastion, past the entrance to the ICC car park, which will be able to continue in operation as a public car park. The closure will continue up to Duke of Kent House. Linewall Road will then be open only to taxis, buses and other public service vehicles, for deliveries and to residents who have vehicles registered in their name for an address in the areas accessible only through Linewall Road. Those with a blue badge will also be able to access these areas. We will also close Chatham Counterguard to enable restaurants there to expand their terraces as we change how we attend restaurants. We're looking at a plan to change how Europort Road operates when it reopens to allow only school and residential traffic. All of these areas, Linewall Road, Chatham Counterguard and Europort Avenue, will be magnificent new public realms for pedestrians and for bicycles. There is a lot of work to be done on this. Traffic flows will have to be worked out, and the permitting will be difficult initially. But it is undoubtedly the right thing to do. I'm convening an intergovernmental committee to address this work, which will include all those already working on the Walk the Wall project. This is Walk the Wall on steroids, and it will work magnificently well as part of Green Gibraltar. I remind you that on the morning I was sworn in as your Chief Minister after the last election, I told you I would be humble enough to say that we do not have a monopoly of the best ideas. The Linewall Road idea was featured in the manifesto of another political party, Together Gibraltar. I acknowledge that. Our proposal will be slightly different and more workable, I think, but I will be inviting Ms. Hassan Naan to share her party's ideas with the technicians I'm putting together on the Linewall Road project. Additionally, our scheme will be much wider, with more arteries involved. There will be a full consultation process with the public also on the details, but we will start the closures as from the 1st of June. And there will be work to be done on technology or other mechanisms to provide for digital access control in an advanced manner in future. But if necessary, we will start in quite an analog way. Additionally, we will be introducing charging mechanisms for everyone at Midtown Car Park. Because if we are serious about cutting car use, we cannot encourage people to bring their cars to town each day with the pollution that causes, with the offer of free parking in the centre of town. The charges will therefore apply to local vehicles as they apply to foreign vehicles today. Because we cannot fail to take the good out of the problems that this pandemic has visited upon us. The world into which we step out must be a better world for our children. We must now be looking beyond the immediacy of this pandemic and into the future. So finally, I know many of you will be feeling cabin fever already. I fully understand, especially those who are carers of people with disabilities or those of you in abusive relationships. But let us remember, our lockdown has been less severe than in other countries. What others are doing now as they unlock, we have been able to do throughout. And let us remember also that we have only just started the unlocking phase. We must remember to follow the rules. The lockdown still applies. You can only go out to the shops alone or solo. You can go out to exercise yourself or your pet. And the over 70s are more limited in how they can come out. But we must all observe the rules of social distancing. We have to do it in order to end the lockdown sooner. Going through this today means we can probably end the whole of the lockdown even earlier than we might have expected. It will likely be over soon, and the last patient with COVID will be given the all clear. But it is not over yet. Whilst there is anyone out there, a rogue patient out there with the virus, we must all be on our guard. So let us continue to work together. And let us do so in a way that leads us to a better future when we can emerge from confinement. The rise of a new Gibraltar. That is what we might make the whole of this period worth it. Make everything we have gone through worth it. And make that new Gibraltar the better Gibraltar that we all want. I'm joined this afternoon by the Director of Public Health in Gibraltar, Dr. Sohail Bhatti, who has been our guiding hand through the process of this pandemic, and he's going to address you now before we take questions from those members of the media assembled here and those that they may have sent in already.
Good afternoon. Thank you, Chief Minister. I always start, it's the 9th day of Ramadan. I know this because I have to fast from dawn through to dusk, which is about 15 hours at the moment, 15 and a half hours, where there's no food or water. And the purpose behind that is very much similar to what we've been doing in terms of tackling this COVID, which is about communal effort. It's about doing things together collaboratively because we understand the needs of others as much as we understand our needs ourselves. So you do without water, you do without food, because you remember there are poorer people worse off than yourselves. I'm also minded, and I've said this before, that people often stop me, thanking me, saying what good work I've done. I've got to say I've turned that round, actually. It's not work I've done, but it's a work that Gibraltarians have done. It's been very, very tough to stay at home. It's been very, very tough to stop the instincts that we have as a community of hugging relatives and friends in the street and shaking hands. Many occasions people have had to stop themselves from reaching out to greet a long-lost friend. So it's actually down to yourselves that we've got to the position we're in. And I know what a good position that is because we sampled 1% in our screening exercise last week, 1% of the population of Gibraltar. I just want you to think about that, 1%. If this was the United Kingdom, that would be 660,000 people. That's one of the big reaches and the advantages we have of having a smaller community is we can do this. We sampled 1% and we did not find one single case of COVID-19 infection. I think that means that we have very low levels of infection. What we've done, as we promised, would be to reach out to some of our frontline workers who are exposed far more than most people to the thoroughfare of people, so you would expect them to be exposed more than others. This is different from the random sampling we've carried out before, which were people that we'd randomly picked off that were living here. So this is not a true assessment. It may just be that the groups of people that we reached out to were in some way protected. So for example, when we screened the entire prison and the inmates, we found no cases. That might just be a reflection, I'm pretty sure it is, a reflection on how well that small community had managed its own business to ensure that there weren't people with problems. So We've screened 1% this week. My aim, actually, is to aim for 1.5% per week. It's not the same group of individuals, but I hope by doing this on a rotational basis, we'll cover everybody in our frontline services so that everyone, at least in a 6 or 7 week period, knows that they haven't got the infection. It's important to remember the test only tests if you've got active infection, so it works best if you have symptoms. And remember what the symptoms are that we're looking out for: a fever, a new cough, breathing issues. You know, you're doing something normal and suddenly you find yourself breathless for no obvious reasons. Fatigue, severe fatigue is also quite a common symptom. In Gibraltar, people tend to also have headaches and loose motions, and obviously there's a sore throat. But about 80 to 90% of people have no symptoms at all. But if you do have symptoms, please ring 111. That is a good way for us to find out how much active infection there is, because people with the symptoms are more likely to have the virus in them. Just in terms of other issues, I said before that there's been a lot of complaints about people having a test done and saying they've not been contacted with respect to their test result. I'm told that the records we have of people's phone numbers in the GHA database aren't always accurate, so can I beseech you to try to ensure that we have accurate phone contact details for yourself. There is a website which is gha.gi/, and that's G-P-registration. If you type that into a search engine, you should get to a landing page which allows you to fill in and update your details, including assigning a GP. That's really important to us. We cannot contact you if we do not have your accurate details. And one of the other issues that I'm concerned about, so I don't just do COVID for a life. My job is also looking at the well-being of the population as a whole, and one of the things I can't ignore is the degree of alcohol consumption there has been over the last few months. Now, again, I do understand that people have to do a bit of self-medication, particularly when they're at home. It's turbulent and problematic, but that does mean that people will suffer from heartburn. It does mean that we will have more people with accidents. It does mean that we will have more domestic violence and possibly also harm to children. So just be mindful that for everything we do, there is a reaction and a cost. And essentially, if you abuse the alcohol, it abuses you socially, but also your body, and it harms your liver and it harms your stomach. And you may even develop some stomach ulcers if you're particularly on some kinds of medication. So please, please, please do contact your GP. If you do have problems that you are tolerating, it's better that we address those early rather than late. But please mind the amount that you're drinking. It's not good for your liver in the long term. It's certainly not good for your mind. I've met many people who have dementia because they've drunk themselves to that position. They've essentially pickled their brain. People ask me about over 70s and whether we should maintain our protection of that group, that in some way people who are free and are fit should have the same degree of constraints placed upon them. I do not have a test which I can apply to anyone to say that you are okay and you are not. There is a degree of, as we begin to understand this disease, it appears that this disease, for most people, it only sits in the lungs, you get a mild cold and you're over it. For some individuals, we're quite not sure why, but it can get into your bloodstream in a sufficient dose that the virus replicates, and it then sits and seems to affect what we call the endothelium of our blood vessels. I don't mean to go technical on you, but it's the lining of your major blood vessels, and it seems to create a degree of inflammation and irritation there, which can then lead to all sorts of problems, including clots. It's an oxidative stress reaction, which you also find in people who are overweight, and you also find in people who have heart disease. That is actually one of the reasons why people with those conditions do less well. It's one of the causative agents, in fact, of atherosclerosis. Hardening of the arteries is oxidative stress. Finally, as the weather heats up, can I encourage people to try to use open windows and doors to allow air through? There is evidence that air conditioning itself can aerosolize the virus. It doesn't really matter if you're in your own home, but something that we need to think about if we're trying to avoid the spread of the virus is use air conditioning as least as possible. Not only will it save you electricity, but it will ensure that the flow of air through your environment keeps the virus levels low. I don't really have much more to say beyond that, so I think it'll be down to questions hereafter. Thank you.
Thank you very much indeed, Dr. Batty. So now we move on to questions from members of the press who are assembled here this afternoon or who may have sent their questions in. Let's start with GBC. Jonathan.
Chief Minister, we've seen plenty of evidence this weekend that people are clearly not keeping to the social distancing guidelines, not just in shops, but in main streets and other public places. You said that this is not something that we're going to police, but as a result, could we be seeing a spike in cases in the coming weeks? And if so, is it something that the government might not necessarily see as a negative thing because we're building people's antibodies?
Well, no, I mean, the whole reasoning behind applying a lockdown is because we are not pursuing the attitude of saying, let as many people as possible get infected. We would not want to see the GHA overwhelmed. That's why we went for a lockdown, to ensure that we have the ability to deal with the numbers of people that might manifest with the virus. But at the same time, we must not continue to restrict people's civil liberties or their ability to trade more than we need to. Now, you say that there's concerning evidence about what happened this weekend. Look, we're all human. We all react in the same way in two respects. First, when we're told that we have an element of freedom, we try and take as much of that freedom as possible. Second, when we see something that suggests that it is contrary to the rules that we're trying to enforce, we get very agitated to see others not respecting the rules. But look, I think that the GBC report that I saw this weekend, which was a video report, is a much better piece of evidence than any still photographs that we have seen. Because the perspective of a photograph means that you're not able to judge the distance between people, because a photograph is a one-dimensional image, whilst the video gives you the motion and movement of people as well. And the work done by your colleague Kevin Ruiz at the weekend actually showed how people were moving about Main Street, not in a snapshot, but in terms of activity. And if you looked at that activity, people were not stopping, people were moving, they were keeping to the rules of social distancing in the main. Look, there may have been some instances where you might have got closer. But Dr. Batty and the medical advice tells us that we have to be within 1.5 meters of each other for more than 15 minutes in an enclosed area for there to be a risk of transmission, as long as we are also observing the rules of good respiratory and personal hygiene. In other words, as long as we're not coughing over each other or breathing over each other, if we're not in an enclosed space for 15 minutes in that level of proximity, we shouldn't be so concerned. So the license that we gave people this weekend, which I think was not observed and which does concern me, is as an individual, one person from a family, to go to a shop in the same way as we've been permitting throughout in terms of a supermarket and a grocery shop. People, I think, in some instances thought, well, I could go with a relative, because I go out with a relative to exercise, I can go out with a relative to the shop. Well, look, this is not something that can be policed. If you're walking in Main Street with a relative, are you exercising or are you going to the shop in breach of the rule that you should go alone? This is down to personal responsibility. And I appeal to every single one of my fellow Gibraltarians to show that personal responsibility. Because, for the past 6 weeks, I think we have been exemplary as a nation. We really have done the job that we needed to do. And all of that sacrifice might be thrown away if we fail to understand what the rules are today. And so what I saw at the weekend was not hugely concerning, but it could become hugely concerning. People need to realize that they're able to go to the shops, but to go alone. If they want to go to exercise, they can go with a member of their family in the way that they've been doing until now. And we need to just get to the end of this process to try and ensure that the virus is as under control as possible and the GHA is as much able to react as necessary should we see a cluster or a surge in the future. So for now, I want to be actually very supportive of what people have done this weekend, and I want to just ask them to show a little bit more self-restraint and understand why it is that we have to keep the beaches closed, why we want them to exercise. The obesity is turning out to be a bigger issue than perhaps any other factor in the context of this virus. Age and obesity, those are the two key factors. So we need people to exercise. One of the things we need to take forward is the fact that suddenly everyone in Gibraltar seems to need to go out for exercise at least once a day. Let's keep that going. Once you've been doing it for 6 weeks, there's no reason to go back into the cocoon and the bubble and the car. Let's take the good out of what's happened, not just this weekend, but in the past 6 weeks. Priya for the Chronicle.
I have a follow-up question to that one. Dr. Bhatti, this one's for you. Have your team been able to define the triggers that would lead to a reimposition of the restrictions?
We've been working quite hard on it, actually, and I've had a number of conversations and a number of attempts at it. The problem that we face is there isn't a magic number that I can pick. So we've got such low levels of a population that's very small. So for us, 5 cases, 10 cases, even 20 cases is quite a significant rise. But that 20 cases might just represent background noise from a statistical point of view, or it could represent 20 cases that's about to go into a big leap. They have provided me with an Excel sheet where I can play around with some of the figures, but the underlying assumptions, I think, in this are that we're going to have to look at other ways of measuring than just statistical ones. I think we will use the statistical measures, but we'll have to look at how many people are admitted. I think, interestingly, we may well want to look at what the prevalence of the disease is. So 20 cases when there isn't a lot of disease around, according to our screening programs, is probably going to die away as long as people maintain social distance. If they don't maintain social distance, 20 people walking down Main Street when it's busy as it is would be 200 cases 10 days' time. And I have to say that what happened in terms of good weather, we will see a week later in terms of how many people get infected. Fortunately, because infections are so low, it's probably not going to produce a big spike. So 20 cases when we've got low prevalence is nothing, but 20 cases when we've got higher prevalence can be the preemptive bit that leads to the spike. And that's what we have to watch out for.
So can I just come in on that? Because I think we have done such an excellent job as a community in the past 6 weeks that it's important that we don't lose sight of the fact that these numbers are now very low indeed. We started with an index case in February. We're now at a situation where we have just over 10 digits or 10 individuals. It's likely that that is going to continue to come down. There may be 2 or 3 others in the random sample. Look, we've had, I think in our random sample, almost 450 people tested now, and only 2 have tested positive. So this is actually very good evidence. When it comes to unlocking, there were triggers that were set up by Public Health Gibraltar, which we needed to hit before we were able to start the process. If we were ever to lock down again, the statistics, as Dr. Bhatti says, will be important. But we didn't lock down on the basis of statistics. So if we lock down again, we'll lock down again on the basis of a combination of statistics and the ability of the GHA to deal with any surge that may appear to be coming. Remember, we're much better prepared now. When we locked down, we didn't have Nightingale ready to go. We didn't have the number of ventilators that we have today, which is almost 60. Look, it depends what it is that you read, but there is a suggestion in an article in the New Scientist that you need to have 30 ICU beds per 10,000 head of population. And there are other nations in Europe saying that they're free now and to unlock because they have 1.5 ICU beds per 100,000. So look, in the context of those sorts of statistics, we would never have had to lock down. especially now that we are so prepared. So it's a combination of factors, and I think Dr. Batty is right to say that this is not something that you can just discern on the basis of a formula. There is no algorithm to lock down again. This is not a computer program. This is about a combination of politics, public health, civil liberties, and ability of a health authority to deal with these issues. That is extraordinarily complex. That's why, with the advice of Dr. Batty, we locked down, facing what then appeared could become a real crisis for Gibraltar. That's why we were moments away from a government of national unity. That's why we've had to invest the amounts we've invested in our cemetery to be able to deal with a number of corpses that we thought we would be dealing with. Let's remember in sunny first week of May where we were in very difficult circumstances in the middle of March. And let's remember that it's by making the sacrifice that we made in that period that we've got ourselves here, and the community must bear that in mind as we slowly unlock, to have that self-restraint and sense of responsibility to help us to get to the right conclusion in the right time frame. Perhaps I should go now to a question from our colleagues who aren't here.
Thank you. Yep, I'll first read out a question from the Panorama. The British Medical Association said in Britain that a blanket ban on any section of the population being prohibited from lockdown easing, quote, would be discriminatory and unacceptable, end quote. Those at highest risk from infection should be protected, but added that, quote, this needs to be based on individual risk that would apply at all ages rather than an arbitrary age range of 60 or 70, end quote. And a warning from the Royal College of General Practitioners says that prolonged lockdown would impact the physical and mental health of the over 70s, and that age alone was not the best way to decide, quote, who should self-isolate and to what extent, end quote. Does the panel agree or disagree with those principles?
I fully agree. I fully agree. As a layperson, I'll allow Dr. Batty to comment on the medical aspects of this. But look, you've got to understand what we've done and what it is that we may be doing in the future. In Gibraltar, we have extraordinarily got 2 lockdowns, one for the over 70s and one for the under 70s. But it's absolutely true that there are those in the under 70 category that are as vulnerable as the over 70s. Although the statistics don't bear that out directly, because if you look at the statistics, as Dr. Batty put it to me very figuratively, I think in the cabinet meeting where we locked down, the disease seems to almost have drawn a line in the sand of age. And you look at the people who die, and 95+% are over the age of 70. But we've got to realize that once we've controlled this in this initial stage, we are surely not going to put our over 70s into house arrest for their own good. They might say, well, look, what is the point of living a life where I can only go out for an hour to exercise and go to Morrison's? Do I really want to live that life? I think as we control the virus, we get to a stage where we take a different sort of attitude. And whether you're over 70 or in another one of the vulnerable classes, you are told, the advice to you is that you should stay home as much as you can until there is a medicine that deals with this as a cure or a vaccine that prevents you from getting it. But look, if you go out, it's a matter for you. I mean, to what extent is the state expected to require people by law, by compulsion of law, to stay home because they're required by law to stay home in order to save their lives, so that they might either drink themselves under the table or, D-vitamin D themselves into a difficulty, or any of the other issues, mental health issues that might arise from a continued state of house arrest for the over 70s. But we're not there yet. In other words, we're not yet at the stage where we can say, right, now we've dealt with this part of the virus, we can now make an assessment of how we deal with this going forward. Do we allow some other mechanisms for over 70s to be able to access services in a way that enables them to go out when they need to, but not have to? This is extraordinarily complex, but I sincerely believe that our over 70s have shown great forbearance in accepting the rules of lockdown, because I think the GHA would have been completely overwhelmed if our over 70s had not accepted that. There would have been a lot of people requiring care. There would have been a lot of deaths. That's what the evidence points to. And by doing this in this way, our over 70s have helped us to stop the GHA from becoming overwhelmed, and the GHA has been able to continue to operate and prepare. But as we look forward, and I think I've said already in one of my interventions earlier this month or last month, this is going to be more about social responsibility than it is about legislation. Where I do think the key point comes, and this is what Panorama is identifying, the over 70s, the otherwise vulnerable, or those who are diagnosed. I think that's where compulsion will come. If you are diagnosed with the disease, you will not go out into the street. And that it appears that some people are taking the attitude that, they think that they're okay now, even if it's less than the time that they were told. No, I'm sorry. You create a huge risk for the community by going out onto the streets or going back to work before your period of confinement and potentially retest has been dealt with. And that's where compulsion of law should come in. So I say to our over 70-year-olds, thank you for your forbearance. I hope we will be able to move to a different stage, which is a stage of recommendation and strong advice, and move away from compulsion of law and apply the compulsion of law to those who are really irresponsible and putting people at risk. Dr. Matty?
So the wisdom of experience has meant that, as Chief Minister has said, this has been as much a social lockdown than anything else, that people themselves have decided what's safe for them. And it's not just the senior citizens, it's their relatives that value their own parents and grandparents, and they've created this isolation process. I'm a member of the BMA. I've been a member for 30 years. In fact, for the last couple of years, I've been an office holder in the British Medical Association. So I do see on the listserv these conversations that are happening. I've got immense sympathy for them. But the ultimate question is, do I have a way of being able to tell a person you're safe if you fall ill and you're not safe? And what I haven't got at the moment is that assuredness. I think what we have demonstrated as this disease has developed and our knowledge of that disease has developed is a greater understanding of this disease. So I do hope as time passes, and there's an awful lot of research going on at the moment, that our greater understanding of this disease may help us identify people who may be at more risk than others. I also hope that some of the trials that are taking place will mean that some of the medication will help if you do fall ill. And that will just generally mean that the risks will reduce. People may remember that when HIV was around, we didn't know anything. It was a death sentence. Now it is just a chronic disease that you manage with the right treatment. So in essence, I mean, that's happened again and again. Tuberculosis was another disease that was called the white man's plague in the Middle Ages, and is now treatable, if not you can't necessarily cure it, but it is treatable. So I hope this disease turns into something that we can treat, we can manage, we can diagnose. And what I'm asking for is a little bit of forbearance as knowledge increases. I know in the GHA and in Gibraltar are doing our hugest amount of effort to get hold of any particular advantage that we can. So, for example, we are trying to locate and source a new test that might give us some sense of people who've had previous exposures in terms of immunity. We still don't really know whether the immunity is going to last for a long time, but even an immune memory for 6 months would make a difference for certain individuals if they know they've had the infection and they're not likely to have it again. So these are things that we're trying to explore, not necessarily got there yet. So I ask my elderly senior citizens in Gibraltar for a little bit more forbearance, but keep in mind we're already aware of that, which is why it's not been that long, but we have had the golden hour instituted, particularly to address those issues around poor mental health as well as physical health. We do recognise that that's a necessary requirement, but we still have to protect you, because at the end of the day, one of our great achievements has been we have avoided the consequences everywhere else of body bags being piled up. And as I say, that's a great tribute to the people of Gibraltar.
Thank you.
Thank you both. I'm going to move on to a question now from YGTV. It's for Dr. Batty. When will it be safe to visit elderly relatives?
I think the answer I've sort of already woven into the previous one. When I've got a test that enables me to define when it's safe and who is safe to meet other people, whether they're their relatives or others. We might be getting there. I don't think that it's that far away. It's difficult always to put a price on these things, but I would count these things in terms of weeks rather than months, I would hope. And once we can manage that, we would then need to find some way of enforcing it, because if it becomes a free-for-all just because someone says I'm okay because I want it to be okay, we will face the scenario of the hospital full of really sick people.
Okay.
Thank you, Dr. Bhatti. Our next question is also for you, and it's from the Olive Press. Could you please reveal further details of the tripod testing equipment to be used at the frontier and elsewhere in Gibraltar? If a person is registered to have a high temperature, how does that lead to any action on the part of the Gibraltar authorities? And is the person notified in any way, or is the testing purely an advisory measure?
Certainly, we're still working out the optimal route for this, but these are infrared cameras they've used already in China. You may have seen them on your television screen, where people get scanned, multiple people can get scanned at the same time. A little temperature appears on next to that individual. We've got to work out the standard operating process. Personally, I think it'd be easier to tell a person that their temperature was up. But as Chief Minister had said, we do not live in a coercive society. This has got to be socially driven. And in fact, what would happen is a person would be told that they had a temperature, and they would be advised to turn back, go home and phone 111 if they happen to be a resident of Gibraltar. If we start to get these cameras, as is the plan at the frontier, similar kind of process will be asked. Obviously, they can't ring 111 if they don't have a Gibraltar phone a card, but otherwise, we're asking people to be socially responsible.
They've been deployed today already, and people who have a temperature will be denied entry into Gibraltar. As we progress and we're able to put in place different protocols, we will be potentially able to offer a field test at the frontier, or we'll be able to offer a test at your place of residence. So I think I said last week we were looking at the possibility of being able to deploy people from Spanish private laboratories to come and test people in their homes in Spain, or require people to go to these private laboratories in Spain to have their tests during this period, as we ask people to call 111 if they are symptomatic in the mornings before going to work. There's a lot of work still to be done with CELAC on how we deal with the sick claims, the sick pay claims that there will be from such persons, etc. GBC.
Chief Minister, you will have heard the Spanish Premier Pedro Sanchez today suggesting that he anticipates that Spain's borders might have to be closed until October. So my question is, how does this affect Gibraltar, and do you still keep the lines of communication with the Spanish Foreign Secretary that you established last month in the COVID context?
So the lines of communication with the Spanish Foreign Ministry are actually very fluid at the moment. You might expect that to be the case, because we're in the middle of also trying to deal with Brexit against a timetable that is devilishly difficult. So we're going to be in touch about whether the ability to cross the frontier will continue to be curtailed in different ways. I mean, we have people in Gibraltar who have second homes in Spain who want to ensure that their property is being looked after. If the Spanish borders are closed, the question is whether hotels will be accessible, so the use of Spain for leisure may be more curtailed than we might expect. Or indeed, we may be able to agree the ability to enter and exit Spain will be more normalised for the purposes of residents of Gibraltar. But that is for discussion at this stage. Remember that this will obviously be reciprocal, so if the frontier opens for us to be able to go to Spain, other than for work or because we live there, it would also open for Spanish residents to be able to come to Gibraltar. And that would create all sorts of other issues also about testing and the general flow of people into Gibraltar, not just the working cohort. So this is not easy, and it's something that we need to look at in the context not just of how the disease develops in Gibraltar, but also how it's developing in Spain, and what confidence we have that we wouldn't be importing the virus from Spain before October. Priya?
If someone is forced to stay at home under compulsion of law because they test positive, what happens to the other people who share the same residence?
So the issue of how we deal with self-isolation going forward is one that you'll see dealt with in the context of the Unlock the Rock document, because self-isolation must be extended in all likelihood to the household, to the whole bubble of those exposed. When you're talking about contact tracing, there's no point alerting everyone that's been within 1.5 meters of you for a particular period of time so that they might self-isolate until they're tested, and not also asking people in your home environment to self-isolate until they are tested, or until you and they have gone through the period of 14 or more days and a retest in order to be able to emerge. I think that's part of the logic of what we're going to be, the phase we're going to be entering into. Okay. I don't know whether there's another question from those who are not here.
There are, apologies, I dropped my phone. The second question is from Panorama. A statement issued yesterday on World Press Freedom Day says that independent journalism is vital, particularly during a crisis such as the COVID pandemic, in ensuring our leaders remain accountable, their policies scrutinized, and that there be a daily free flow of information. You must agree that there is no democracy without press freedom.
I fully agree that there's no democracy without press freedom or indeed parliamentary oversight. And in the measure that we have had to curtail parliamentary oversight, we're hoping to bring that back as soon as possible at the end of May. And in the measure that we have had to control access to our press room, we've done two things. First is that we have offered an unprecedented level of information to members of the press so that they can obtain it and scrutinize it. We seek to issue the scripts of these information conferences as soon as the conferences are over, so that members of the press and indeed others can pore over it and comment on it. And we also have ensured that, in keeping with many other nations, we've seen it in Spain and in the United Kingdom, which are perhaps the two nations we have greatest insight into, members of the press have been able to ask questions through modern digital means, although that's no replacement for actually being in the room and being able to ask us follow-up questions, but we've tried to ensure that we are as accountable as possible in the context of the pandemic. There's no desire on the part of the government not to be accountable, or indeed not to have members of the press present. That's why we've ensured that as soon as possible we've allowed members of the press to come back to number 6 Commonplace, and we're often joined by a number of them observing the rules of social distancing in this room in so far as we're able, and controlling numbers for that reason, but fully exposing ourselves to the cross-examination of our colleagues in the media.
Thank you, Chief Minister. Our next question today is from the Olive Press, and it's for you. Can you give more details about how many instances there have been of people with COVID-19 who have refused to self-isolate in Gibraltar, and how serious is this issue has transpired to be a problem?
Well, I've had 2 instances reported to me of people who are believed not to have ended the period of quarantine or confinement that they're required to carry out, who have been seen out and about. And now that is anecdotal evidence, which is now being investigated in order to determine whether it is correct or not. Look, I'm very conscious that anecdotal evidence is no evidence at all, and therefore until we have had confirmed that individuals have been out in the period when they should have been self-confining, we can't make any judgment. But if that is manifesting, it is very, very serious indeed. And the fact that it's been reported, even though it hasn't been confirmed, is what's leading the government to realize that we need to have rules to enable us to enforce those confinements so that we don't have those issues in the future. I mean, remember that these viruses start with an index case, and they spread from an index case. Sometimes they spread from others which are not the index case, because you're just not aware that the virus is around. And therefore, in order to be able to control clusters, you need to have, obviously, the authority and power to do so. If people were to decide that for reasons known best to themselves, they're not going to follow the advice and the recommendation that they have for their good and for the good of all of us. So that's why we're going to have to pursue the ability to have the coercive power to enforce self-isolation. Of course, it's not self-isolation. If it's coerced isolation. And if it were to, as I said during the course of my initial remarks, if it were to be enforced because the individual is recalcitrant and is insisting on going out, it would be enforced by imprisonment, which is the mechanism that our constitutional system allows for confinement by use of coercion.
Thank you, Chief. Our last question today is from Your Gibraltar TV, also for you. Today, some officers have returned to their usual routines and staffing levels, while others have kept to split teams, with many staff members continuing to work from home. What is the government's latest advice regarding this?
So the advice is to continue to work from home if you are able to continue to have split teams if you can, to ensure that if your office is affected by the virus, you can have a business continuity operation by bringing in the alternative team. That's how my team are operating. I've been in my office constantly, but half my outer office have been working 1 week and the other half the other week. That's the prudent way to do it. And I think that is going to continue to be our advice for some time. And indeed, there are many advantages from home working. There are potential distractions and disadvantages, but many advantages also. We've been reading about teleworking for the past decade. The past 8 weeks have made it a reality, and all of the technology that was developed and was not really in use has really seen an uptake like never before. I would encourage as many people as possible to stay away from the communal environment in offices unless they have to be there, and to try and stay working from their home environment and to be economically active at home. I think that is the best way to ensure that we keep the virus at bay for the longest period, so that we have the biggest chance to beat it. And therefore, I would think that is also the best advice to all those in our economy, unless they have a job which requires them to be in a particular place. But these days, office work does not require you to be in the same office. I mean, I used to say before the virus that I could do my job with my BlackBerry in a locked room as long as I had either a 4G signal or a Wi-Fi signal, and that continues to be the case today.
Thank you. There's no further questions today.
Thank you all very much indeed. My dear friends, when the Gibraltarian awakens, nothing can stand on his or her way. So let's be clear that the rules of lockdown continue, but that there is a great opportunity for us to shape a different and better Gibraltar going forward. But let's make the sacrifice count. Let's not throw it all away. We're not going to get there overnight, but we're almost there already. So please, it's your responsibility to ensure that we do not throw the sacrifices of the last 8 weeks away by observing the rules of social distancing, by observing the rules of personal and respiratory hygiene. That means not hugging or kissing people who are not in your household group. It means coughing or sneezing into a tissue. You've heard us say it 100 times before, but please continue to observe these rules, in particular in hay fever weather, because you may not think you've got COVID-19. The hay fever may make you sneeze, but you might have COVID-19 and you're unaware of that because you're asymptomatic and you're spreading it unless you catch it in a tissue. And then please observe the usual rules of hygiene by washing your hands constantly. As I've said on a number of occasions, I sing Dr. Batty happy birthday twice, more often than I ever imagined I would, as I wash my hands continually over and over again each day. But that basic hygiene is what's going to get us through this difficult period. Thank you very much for all of your sacrifice in the past 6 weeks. We're not out of the woods yet, but we're almost there. Thank you for watching us this afternoon.